It is time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, Chris. Morning, Paul J.
Good morning. Doc, this coming Saturday is Drug Takeback Day. What's that all about?
Yeah, so twice each year, in April and October, the Federal Drug Enforcement Administration, or DEA, sponsors National Prescription Drug Takeback Days, where people can turn in their old or unwanted medications to have them safely disposed of. This event is this Saturday, April 28th, from 10 a.m. to 2 p.m.
Why should people turn in old medications?
Well, they're a bit dangerous, Chris. Having old medications around your house and in your medicine cabinet can present a risk to small children or sometimes teenagers who might be inclined to misuse them. Research has shown that most of the abused medications or prescriptions are obtained from family and friends, often from a home medicine cabinet.
Why not just toss the unneeded medications in the garbage or flush them down the toilet?
Well, putting them in either of those places takes care of the immediate problem, but it doesn't make them safe. In other words, from opioids to antibiotics, zithromax and amoxicillin and other narcotics, anything that goes down the toilet or ends up in the trash ultimately ends up in the local waterways and community drinking water. So not all of this residue from these drugs is removed during the water treatment or purification process. Throwing these unused or expired medicines in the garbage not only leads to these drugs ending up in landfills, but also runs the risk of kids finding them in the trash can before the trash is taken out.
Okay, doctor, where can people go to get rid of those old prescriptions?
Well, the DEA has set up a website. It's takebackday.dea.gov. And it has a collection site locator. So you put in your zip code, and it tells you where the local collection sites are for this Saturday.
How much medication is typically collected at these events?
You know, last year, during the October event, the DEA collected about 450 tons of prescription medications.
Wow.
Particularly now, given the opioid crisis that we've talked about that grips both the country and our state, it's more important than ever to dispose of these drugs, and it seems a lot of people are heeding the message.
What should people do if they would like to turn in some old medications, but they're not able to take part in Saturday's event?
Well, people can take in their old or unwanted medications at any time at collection kiosks at certain pharmacies, like the Walgreens at 8100 Fairview, or the other Walgreens at 700 12th Avenue in Nampa. Those are available anytime, not just this Saturday. They can also go to local law enforcement offices, which have worked with a local company called Truth 208 to host dozens of these kiosks across Idaho. Regence is also sponsoring kiosks in other Walgreens locations, and we'll talk more about that. People can also check with their local pharmacy or doctor's office and talk about safe disposal. The FDA also has some safe disposal guidelines on its website.
All right. Good stuff. Thanks, Kenny, for the enlightenment today.
Thanks, guys. Have a great day.
Thank you, Dr. Bramwell. It's the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence.